Hello, everyone. I'm Richard Conway from Dublin, Ireland, reporting virtually for Room Now from ACR 2022. I'm here today to talk to you about a poster that was presented at Sunday's poster session by Meng et al. This is poster 1207. It was risk factors for major cardiovascular events in inflammatory arthritis, time-dependent analysis of inflammatory burden, DMARDs, NSAIDs, and steroids. Now, you may remember this same group presented somewhat similar study at ACR 2021, which I've also talked about. That study was one of 200 psoriatic arthritis patients. And in that, they showed that non-steroidal anti-inflammatories appeared to be associated with a decreased cardiovascular risk. So they're back again with another study now. And the background to all of this is that we know that in the healthy population, that non-steroidal anti-inflammatories are associated with a small but significant risk of cardiovascular disease. We also know that our inflammatory arthritis conditions are associated with an increased cardiovascular risk. So the concern is that these non-steroidal drugs, which are symptomatically helpful for our patients, and they like to take them sometimes, that potentially they could be associated with quite a significant cardiovascular risk in our population. So in this study, the authors have come back with a much bigger study. So 200 patients the last time. This time they have 17,732 participants. They have inflammatory arthritis patients with rheumatoid arthritis, psoriatic arthritis, and axial spondyloarthritis. It's a retrospective observational population-based study. It's looking at the first MACE in these patients and the role of time-varying CRP and ESR and medications in predicting MACE using multivariable Cox regression. This study had a median follow-up of 8.7 years for the participants. There were 1,069 MACE events in the study. And there were a number of interesting findings. So in terms of things which decreased your risk of cardiovascular events. The hazard ratios I'm going to give you here, they're all a little bit variable because there are a number of different models in the study, but mainly we're focusing on the rheumatoid arthritis patients and looking at the model that included CRP rather than ESR. So what they found was that methotrexate was associated with a decreased risk of cardiovascular events with a hazard ratio of 0.75. Somewhat similarly, both COX-2 inhibitors and non-selective NSAIDs were associated with decreased risk of cardiovascular events with hazard ratios of 0.77 and 0.79 respectively. They did not find a similar effect for biologic DMARDs or for sulfasalazine. They also found a number of things which increased your risk of cardiovascular disease, and most of these are probably not surprising. So medication-wise, steroids are bad, hazard ratio of 1.7. CRP was associated with increased risk, probably as a correlate of disease activity, relatively small hazard ratio of 1.1. And then in terms of traditional risk factors, so lipids, hazard ratio of 5. Hypertension has a ratio of 3.7. So they're the big ones. Then other typical ones, so male sex has a ratio of 1.4 and diabetes has a ratio of 1.2, so not so big. Disease duration has a ratio of 1.1 and age has a ratio of 1.05, so smaller effects. Overall, my takeaway from this study is that this give some support to the hypothesis that actually we can be a bit more comfortable using NSAIDs in our patients if they have active inflammatory disease, that perhaps by reducing that inflammatory disease, they do not carry the same burden of cardiovascular risk as they do in people who do not have a systemic inflammatory disease. Please log into Room Now for more updates from ACR 2022 and follow me, Richard P.A. Conway, on Twitter.